We have today Stacey Rodriguez. She is 40 years old, been a patient for 6 years, and has been on testosterone replacement therapy for a little over a year and a half. And what Stacey has done is put her story on paper, and she'll read it to us. You're on.
Okay, my name is Stacey Rodriguez. Over 1 year ago, I walked into Dr. Gordon's office, and he asked me what brings me here today. I said to him, either there is something medically wrong with me, or I am losing my mind. I'm not sure if I should be here, or I should be seen by a psychologist. He asked me why I felt this way, and I began saying how I felt. I stated that I felt miserable, I was always tired, and very emotional. As I stated this, I began to cry uncontrollably. He handed me a box of tissues and said to me that I appear to have the classic symptoms of someone who may be lacking a significant amount of testosterone. Thought to myself, testosterone. Okay. He began to explain to me what was testosterone, and he started asking me a series of questions. Some of the questions he asked, aside from being tired and having mood swings, was about my sexual activity, which was another problem I was having, but of course they didn't want to discuss that because I felt embarrassed. I wasn't having as much sexual relationships with my partner because of a lubrication issue. He began explaining how testosterone worked and how it's used and how it's produced in our body, and with a simple test we can determine my level of testosterone, and that if he was wrong about his assumption about me lacking testosterone, that he would gladly refer me to a psychologist. I agreed to have my blood drawn, and within a few days the results were in. I called him, and he said that I was like a woman who was 80 years old. I had no testosterone, I was not producing any, no wonder why I feel the way I felt. So today, I receive a shot of testosterone every 3 weeks. I feel amazing, I have energy, my moods are better, I can deal with stress without being overwhelmed, and my sexual activity has increased. I myself am very amazed of how quickly I begin feeling results. Since the shots, I have had some hair growth, which is a common side effect, but in comparison to how I feel, that is very minor to me. I have experienced some acne as well, but as we played with my dosage level, we are able to, the acne has been subsided. I no longer have acne. We started at dosage of 60 cc's, and now we're on 25 cc's, which is working great. The hair has subsided, the acne has gone away, and I still feel wonderful. I feel like a new person. Feeling depressed and miserable is no way to live. If a shot of testosterone is what I need every week for every few weeks, then so be it. It has given me my life back, and I'm proud to have a shot every week without any complaints.
Okay, very nice, very nice. I hope that story will bring about the day when every woman is getting the testosterone she needs, and every man. Just, of course, that it wasn't 60 cc's, it was 60 milligrams that we started with, and then 25. Now I start women on 25, and really hair growth is an almost non-existent factor anymore. But everybody feels good. So thank you very much. I appreciate it very much.
You're very welcome.